Welcome to this explainer. Okay, right off the bat, let's get the legal stuff out of the way. Everything we're looking at today is strictly for educational purposes and is definitely not financial and insurance advice. Health insurance rules vary wildly by state, your income, and your exact personal situation, so please, always consult a licensed professional or an official navigator before you make any major coverage decisions. All right, let's dive into this.
A massive, and I mean massive, mathematical shift just hit American healthcare, and it is sending absolute financial shockwaves through household budgets all across the country. We are looking squarely at the 2026 health insurance crisis. Something highly significant just fundamentally altered the system. So today, we're going to break down the data to see exactly what changed, why it changed, and most importantly, what you can actually do to protect yourself. So here is our roadmap for today. We're going to cover the 2026 premium shock, why those subsidies vanished, who's taking the hardest hit, the bronze plan trap, your best coverage options, and finally, beating the subsidy cliff. It sounds scary, I know, but stick with me. We're going to get through this and build you a playbook.
All right, let's jump right into part one, the 2026 premium shock.
Right now, literally millions of Americans are opening up their renewal letters and just dropping their jaws. If that's you, your eyes are not deceiving you. Take the story of Eileen. She's a 26-year-old bookstore manager in Brooklyn, making about $53,000 a year. Well, in December, she logged in to renew her exact same plan for 2026, and her monthly premium went from $147 all the way to $849. Honestly, no way around it. That is a 573% increase in a single renewal cycle. She told us it was one of those moments where your stomach just drops. And honestly, can you blame her?
And here's the really scary part. Eileen isn't just an extreme outlier. Across the board, over 20 million subsidized enrollees in the ACA marketplace are looking at an average premium increase of 114%. That's more than double. We're hearing from families whose premiums have tripled, essentially becoming a second mortgage overnight. Because of this sudden surge, it's estimated that roughly 1 in 10 people who had marketplace coverage in 2025 are now completely uninsured.
So how on earth did this happen? That brings us to part two, why subsidies vanished.
Let's take a quick look at the legislative history here, completely neutrally, just to see how we got to this point. Under the original Affordable Care Act, there was a really strict income cap. Basically, if you made over 400% of the federal poverty level, you got absolutely zero subsidy help. Nada. Then, pandemic-era laws like the 2021 American Rescue Plan and the 2022 Inflation Reduction Act stepped in. They temporarily killed that 400% cap, guaranteeing nobody paid more than 8.5% of their income on premiums. It was a huge game changer. In 2025, a whopping 93% of enrollees got some level of help. But you guessed it, Congress stalled on extending those enhancements, and by law, the whole shebang legally expired on January 1st, 2026. To put that expiration into perspective, the average annual premium cost literally more than doubled practically overnight for subsidized enrollees. We went from about $888 a year in 2025 to $1,904 in 2026. Think about a 40-year-old making, say, $22,000 a year. Last year, they might have paid $0, literally zero, for a silver plan. Now, they're suddenly looking at almost $800 annually. For a tight budget, that's a massive, massive hit.
Okay, moving on to part three, who takes the hardest hit? Now, this pain isn't being spread out evenly at all. 4 main groups are taking the brunt of this. First up, middle-income earners, right above that 400% poverty line. For a single person, that's roughly $63,000. Since that 8.5% income cap vanished, they're suddenly paying the full unsubsidized market rate, which can easily top $10,000 to $15,000 a year. Second, freelancers and gig workers. They're buying their own coverage and don't have an employer to soak up that extra cost. Third, folks stuck on the federal healthcare.gov exchange are faring worse than those in states that run their own subsidized exchanges. And finally, young adults, people ages 18 to 34 who are just starting their careers and are now having to make brutal choices between paying for basic living expenses or health coverage.
And that younger demographic dropping out, that triggers a really dangerous chain reaction. Since the start of 2026 alone, 542,000 young, healthy adults have just flat out dropped their coverage because the math didn't make sense for them anymore. In the insurance world, this triggers what's called a death spiral. It's a vicious cycle where the healthy people bail out, leaving a pool of enrollees who generally need more medical care. And what does that do? It drives the premiums even higher for everyone else who stays.
Which leads us perfectly into part four, the bronze plan trap.
Now, I really want you to pay attention here, because people are frantically trying to lower their monthly bills and falling straight into a massive hidden pitfall. It is incredibly tempting to switch to a $0 or ultra-low-cost bronze plan.
especially when your old silver plan just jumped way up in price. But here's the catch. The average bronze deductible in 2026 is a staggering $7,476. So sure, you might save $150 a month on the premium, but you're taking on a colossal amount of financial risk in the background.
You see, evaluating your insurance purely by looking at the monthly premium is just dangerous. Why? Because until your insurance actually kicks in and pays a single dollar, you're on the hook for that entire $7,000+ deductible. One totally normal health event, a broken arm, a quick ER visit, or having a baby, can instantly throw you into an inescapable debt spiral. Honestly, for most people, it's not a deal. It's just a trap with a monthly payment.
All right, enough of the problem. Let's talk solutions. In Part 5, your best coverage options.
So what can we actually do about this? Let's get you organized. Even with those enhanced subsidies gone, you still have 6 primary avenues. Number 1, the basic ACA subsidies do still exist if you earn under that 400% threshold. So please, go run your numbers on healthcare.gov before you just assume you don't qualify. Number 2, look for state-funded programs. 3, catastrophic plans. 4, health sharing ministries. Though, quick side note, tread carefully there because they are not legally traditional insurance. 5, employer coverage if you have access to it. And 6, Medicaid, specifically if your income falls below 138% of the federal poverty level.
Let's unpack how a few of these options really work for you. State programs are absolutely vital right now. Places like California, New Mexico, and Maryland are actively stepping up to fill the federal gap with their own subsidies. Next, catastrophic plans. These have incredibly low premiums, and recently, regulations were loosened on them. But they really are only best for the young, the healthy, and those with a really robust emergency fund. And finally, employer coverage. Listen, even if your company's plan feels imperfect, if you have access to it, take it. Employers generally cover 70 to 80% of the premium, which almost always beats paying the full retail price on the open market right now.
Finally, let's cover Part 6, beating the subsidy cliff.
If you are hovering right near that income cutoff limit, this is an absolutely critical tax strategy for you. The math of this returning subsidy cliff is genuinely perverse. Let's say person A earns just a tiny bit over the cutoff, at $63,500. They get zero assistance. Now they have to pay the exact same full-price monthly premium as person B, who makes $120,000. It's wild. Making literally just a few $100 over that 400% poverty line completely wipes out thousands of dollars in government assistance. It's wildly disproportionate.
But you can beat it. If you have a variable income or you're self-employed, managing your modified adjusted gross income, your MAGI, is everything. Step 1, maximize your 401k contributions to actively lower your taxable income. Step 2, throw some money into a health savings account, or HSA. Step 3, carefully time when you receive your freelance income or any big bonuses. By using these strategic deductions, you can effectively drop your income back under that cliff and salvage thousands in premium subsidies. Seriously, a savvy tax professional is worth their weight in gold here.
Now keep in mind, while Congress is completely politically stalled on a fix, the next major decision point is right around the corner. Open enrollment for 2027 coverage kicks off on November 1st, 2026. The absolute best thing you can do is proactively manage your current situation today. Don't just sit around waiting for a legislative fix that might never happen. Evaluate your income, run your numbers, and protect yourself.
Okay, I really want to hear from you guys on this one. We've geeked out on the data, but the real reality is in the lived experience. Has your health insurance premium spiked this year? Tell us exactly how much down in the comments. Let's see what people are actually facing out there in the real world. Sharing your story really helps everyone understand the true impact of this shift.
Thank you so much for hanging out and learning with us on this explainer today. If this breakdown helped you make even a little bit of sense out of this massive policy shift, please hit that like button, share this with anyone you know who buys their own health insurance, and subscribe for more focused, data-driven explainers. Ultimately, it leaves us with one pretty heavy question to chew on. Is our healthcare system just destined to remain a chaotic series of financial traps and cliffs, or will we ever see a fundamental sustainable change? Protect your health, protect your wealth, and I'll catch you in the next one.